Several examples of Baker lesions identified in patients undergoing arthroscopic lateral epicondylitis release are shown, such as in this left elbow with an intact capsule or type 1 Baker lesion. A spinal needle is brought in for arthroscopic lateral epicondylitis release to localize a tennis elbow portal, and then a knife is percutaneously advanced, releasing the ECRB from its origin and incising the lateral capsule as shown. Even though the capsule was intact in this patient, notice the degenerated ECRB tendon that's characteristic of patients with lateral epicondylitis. In arthroscopic lateral epicondylitis release, a shaver is advanced into this area and this diseased tissue is debrided away, as shown. In this second example, this time a right elbow, note that the capsule is disrupted but not completely so. This represents a type 2 Baker lesion. In this third example, again a left elbow, note that there's more extensive capsular disruption, but not complete disruption of the capsule. This represents a more extensive version of a type 2 Baker lesion. In this fourth example, a right elbow, note there's complete disruption of the capsule and one can see the extra-articular ECRB tendon through the defect. This represents a type 3 Baker lesion. In case number 5, a left elbow, there's even more extensive loss of the capsule laterally with exposure of the ECRB tendon that can be palpated extra-articularly. This represents a type 3 Baker lesion. Another type 3 Baker lesion is shown here, and beyond the Baker lesion capsule, one can see what represents probably at least some disruption or loss of the ECRB tendon. Case number 7, again a type 3 Baker lesion with evidence extra-articularly that there may be some loss or failure of a portion of the ECRB tendon. In this last example, again a type 3 Baker lesion, note that there's extensive capsular loss and exposure of essentially the entire tendinous portion of the ECRB tendon in this patient with lateral epicondylitis.